Welcome to your guide to gynecomastia correction surgery, also known as male breast reduction. Take a few minutes to familiarize yourself with the procedure and what you can do to help improve your results. Remember, this presentation does not take the place of your consultation, and you should make sure to jot down any questions you may want to ask us later. Gynecomastia is a common condition caused by the overdevelopment of glandular tissue, excessive fat deposits, or both, resulting in enlarged breast. Gynecomastia correction is a popular plastic surgery procedure chosen by more than 18,000 men a year. It is often combined with liposuction of the love handles, balancing the contour of the chest and abdomen. Many men have improved their appearance and self-confidence with this procedure. Procedure: how will your gynecomastia be corrected? In most cases, glandular tissue contributes to your gynecomastia, so it will need to be surgically excised. To begin, a small incision is made either on the edge of the areola or in the underarm. Through the incision, excess glandular tissue and fat is removed. If liposuction is to be used to remove additional fat, tumescent fluid is placed in predefined areas to control bleeding and make the fat easier to remove. The targeted fat is then suctioned out using a thin, hollow metal tube called a cannula. When a large amount of correction is needed, larger incisions may be necessary, leaving more noticeable scars. In some cases where a large volume of tissue has been removed, excess skin must be removed so that the remaining skin fits snugly over the newly contoured chest. Finally, the incisions are sutured closed and dressings are placed to aid healing. An elastic compression garment may also be used to maintain the new contour of the skin. Preparation: every person has a unique perspective on what may be the best shape for their body, and your goals will affect the way your gynecomastia surgery is performed. It is important to discuss your desires and listen closely during the consultation so that you can set realistic expectations. A great result can only be achieved when there is good communication between us. You also need to understand that the shape you have before surgery will partially determine the shape you have after surgery. Together, we will select the technique that will provide the best result for you. When you meet with our patient coordinator, we will discuss fees and costs. Some suggestions to help you prepare for surgery. Your safety matters to us. You should be very open, provide your medical history, drug allergies, list any previous surgeries, medications, diet pills, vitamins, and herbs you are taking, even if you don't think they're important. Also, don't be afraid to be frank with us about your lifestyle. Smoking, the strenuousness of the work you perform, your exercise habits, and the importance of getting back to work. Here are some other tips that will help you reduce scarring, shorten your recovery time, and decrease your chances of complications. Discontinue using aspirin, ibuprofen, naproxen, St. John's wort, and vitamin E for 1 to 2 weeks before and a few days after your procedure. These act as blood thinners and could cause problems with blood clotting. Stop smoking and drinking alcohol in excess well in advance of your surgery and for 1 week after surgery. Drink lots of water in the days leading up to your procedure. Hydration will help you recover more quickly. To make your recovery easier and more comfortable, be sure to arrange for someone to take you home and take care of you for at least the first day or two. Fill your prescriptions before your surgery date and have them within easy reach of where you will be resting. Place plenty of pillows or a bed wedge and a spare compression garment nearby. You will also want to avoid raising your arms above shoulder level during the first few days after surgery. We recommend wearing a button-down shirt to make it easier to get dressed. Recovery: after surgery, you can expect some bruising, swelling, and pain. Discomfort will be controlled with pain medication. However, severe pain is not normal, and we would want to know about it immediately. You may feel like you've lost sensation in your chest, but don't be alarmed. As your nerves begin to regenerate, feeling and sensation should return to normal, though bruising may last a week or more. The recovery process is different for everyone, but within a day of your surgery, you should be up and walking around. In most cases, you should feel comfortable enough to return to work within 2 or 3 days. Stitches, if any, will dissolve or be removed within 2 weeks of your surgery. You may resume sexual activity after a week or 2, but avoid heavy exercise for at least 3 weeks. Your treated areas may remain very sensitive for as long as a month, during which you should refrain from strenuous physical activities, such as jogging, bouncing, or any activity that could cause a direct impact to your chest. Avoid exposing any scars to the sun for at least 6 months, as sunlight can cause scars to darken permanently. If you can't avoid sun exposure, use a strong sunblock. While there will be scars, they are usually well hidden and become very inconspicuous as they fade and mature. Swelling may take 3 months or more to fully subside and allow you to see the improved contour of your chest. What are the risks of gynecomastia correction? This information is not intended to frighten you, but to help you make an informed decision. No question or concern is silly or insignificant. We will be happy to discuss the full range of potential complications and answer any questions you might have regarding this procedure. Many thousands of gynecomastia surgeries are successfully performed each year, and thankfully, serious complications occur infrequently, but they can occur. Complications can include, and are not limited to, scarring, bruising, infection, blood clots, changes in nipple or breast sensation that may be temporary or permanent, reaction to anesthesia, asymmetry, fluid accumulation, and fat necrosis. As with all medical procedures, be sure to choose your surgeon wisely. It is important to choose an experienced surgeon you can trust and develop a good rapport with, so you can openly discuss your concerns and particular needs throughout the process of consultation, surgery, and aftercare. Should you decide to move forward with your gynecomastia surgery, a surgery date will be scheduled. Prior to surgery, you will be given preparation and recovery instructions. Remember to keep your follow-up visits, as we are here to help make this a wonderful experience for you. Feel free to review any part of this presentation you like, and be sure to take a look at our before and after gallery to get a better idea of the results you may achieve.